As a young nurse, I was very aware of the impact of an illness on the family, but I was even more aware of what the family brought to that individual living with a progressive disease, a chronic illness, and how important the support of the family was for that individual.
It was a blind date, and initially we didn't really click, and then about a year later we clicked. And he was a good dancer, still is. He was tall. He was good looking. You know, all the prerequisites. They're wonderful memories that we have. We boated, we traveled extensively. We built homes and have grandchildren and great-grandchildren. And occasionally we'll get frisky and sort of dance around the carpet here or the floor.
So the Caring for the Caregiver program really helps families to live well with dementia. We're all waiting for a cure, and that's really where our mindset is. But in the meantime, there's more than 5.8 million people in the U.S. living with Alzheimer's. There's more than 16 million caregivers caring for those families. So we need to support them in our communities.
Michael and I together would go to the Caring for the Caregiver classes, and I was like a dry sponge. I just couldn't get enough of it. If you get one little nugget of information out of a session that you can take home with you, it's a win-win. And you put a lot of nuggets together, and pretty soon you have something that is life-changing.
Dementia is like living with a big hole in your head. A lot of things that I used to know, and others are saying, it's not there anymore. It's just blank, it's black.
If Michael were to live through all of the stages of dementia, we know where it will end up. But we also have enough confidence in our medical team that when it comes time that Michael might need a different type of environment, they will say it, and I will not argue with them.
With the aging of our population, we know that about 1 in 10 people over 65 will have some form of dementia, and 1 in 3 over 85. And so there's not many families that are not going to be confronted with this crisis.
Each day is interesting and new. I know that the point will come someday where I can't think of tomorrow. We'll see what happens.
As a nurse, it's a privilege to care for families living with dementia, the individual and the family caregiver. Not only am I able to care for them through the art of nursing, but I'm able to bring the research and the science of nursing to make a difference and to make their lives better. I feel privileged.
We're going to live life to the fullest, probably more so than we did in the past. We've got a few trips planned, domestically as well as internationally. And yeah, we're going to live it. That's the important thing.
Love you.